Good evening, everyone. Thank you for joining our JCU webinar series. My name is Jack Growden, and I work as the Alumni Relations and Development Coordinator with JCU. So thank you to those alumni amongst the audience for joining this session tonight. I look forward to moderating this webinar. However, before we continue, I wish to acknowledge the Australian Aboriginal and Torres Strait Islander peoples as the first inhabitants of this country, and I pay my respects to the traditional owners and elders, past and present, of the land on which we stand today. In the spirit of reconciliation, I also acknowledge the valuable contribution that Australian Aboriginal and Torres Strait Islander peoples continue to make to James Cook University and the broader community. Now, this webinar is the latest in a series where we invite our top researchers and academics to share their expertise with the local community outside of the lecture theatre. Tonight, we will be exploring the implications of COVID-19 on maternal and infant health. Chris Rains is our speaker tonight. However, before I introduce her in earnest, just some housekeeping. If you have any questions during the presentation, please type them into the Q&A box in your Zoom control panel. I'll be monitoring this function throughout the presentation and will raise your questions with Chris when appropriate. So without further ado, I would like to introduce our sole speaker this evening, Chris Rains, who is lecturer for nursing and midwifery at the College of Healthcare Sciences based in Mackay. Chris has worked as a registered nurse and midwife for over 20 years in a variety of locations, including the Torres Strait and Arnhem Land, and has been instrumental in the creation of the new James Cook University Mater Hospital Hero Work Experience program, which introduces high school seniors to the wide and wonderful world of healthcare careers. And tonight we are thrilled to have her enlighten us on the impact of COVID-19 on infant and maternal health. So Chris, I might pass over to you now.
Super, thank you very much. Okay, so SARS-CoV-2 infection, the COVID-19 illness, has only been around for a relatively brief time. It first emerged in late 2019, around about November, December, and an unknown illness was reported in Wuhan, China at that time. So because it's such a recent development, a recent illness, studies are still occurring. We still have lots and lots to learn about it. And the information we're getting is changing on an absolutely daily basis. So we're certainly going to learn much more, and studies are still ongoing. But we are developing a bit of a picture about what we can expect in terms of maternal and infant and child health from COVID-19. So COVID-19 during pregnancy does not seem to be associated with an increased risk of miscarriage or preterm birth. Now, the studies are showing that certainly mums who have had COVID-19 are having miscarriages or are having preterm birth, but it's not been related to COVID-19. It's been related to other things. Comorbidities in pregnant people may increase the severity of symptoms. So what that means is if somebody is a pregnant person and they have other issues, other underlying illnesses, so if they've got high blood pressure or if they've got diabetes, those sorts of things may increase how severely they experience COVID-19 if they get the virus. One of the things that we know about pregnant people is that they have a decreased lung capacity because there's a baby and it's kind of squashing everything out of the road, making it difficult for pregnant people to take a deep breath. So the decreased lung capacity of pregnant people may also increase the severity of symptoms with COVID-19, primarily because the respiratory issues, the breathing problems are what we're seeing in a lot of people. So when we're deciding whether we should go and get screened for COVID-19, do you have a cough? Are you feeling short of breath? That sort of thing. So it's a respiratory, a breathing kind of symptoms. So the pregnancy may exacerbate that. So in terms of the place people are having babies, within Australia, there's a variety of choices that people make in terms of where they're going to have babies. But since COVID-19 has come on the scene, there's been an increase in interest in home birth. So one of the bigger groups of privately practicing midwives, the My Midwives group, has had something like a 500% increase in inquiries about home birth since COVID-19 started becoming more prevalent in the media and things like that. So there's certainly an increase in interest in home birth. And a lot of that is due to the concern about going to hospitals where people who have COVID-19 may well be. So pregnant mums, obviously, there's been a big emphasis on people who are more at risk of COVID-19 or who are immune compromised, staying home, staying away from people. Pregnant people have been advised to be cautious about contacts and things like that. So naturally, pregnant people are also concerned about going to hospital where there's potential COVID-19 cases. The International Confederation of Midwives recommends birth in either midwife-led units or home birth where possible. Now, that's midwife-led units tend to be separate from generalist wards. So generally speaking, there would be a healthy population on midwife-led units, or home birth where there's pretty much no contact with other people apart from the family unit and the midwives who would be at the home to help in birth. In the UK, unfortunately, there has been an issue with home birth services closing in some areas due to lack of available midwives. So when somebody has a baby at home, they need to be attended by 2 midwives wherever possible. And because the nurses and midwives in the UK are getting sick, they're getting COVID-19. And so they're not able to attend, they're not able to be working, and so they're not able to attend home births as well. So because a home birth takes 2 midwives out of circulation for the wards and the rosters and things like that, some of the places in the UK are shutting their home birth services. Now, not all of them, but certainly some of them. New Zealand home births are pretty much continuing as per usual. New Zealand has just got it sorted, bless them, doing a marvellous job over there. The Netherlands are introducing pop-up birth centres, and what I mean by that is they've kind of commandeered hotels and motels and things and said, hey, we're having babies here. And it's working really effectively, apparently. It's keeping the pregnant population and babies away from hospitals where there is potential COVID-19. And they're being staffed by midwives, and it's working really well. Some organisations are recommending hospital birth due to an increased need for fetal monitoring. And as with anything, in terms of birthing, it needs to be the decision of the parents based on information they're given and being aware of all their choices as to where they have babies, basically. So in terms of the actual birth, the getting the baby out bit, there's no need for caesarean specifically due to a COVID-19 diagnosis. So certainly if there was a planned caesarean anyway, or there's other factors that would lead to a caesarean, fetal distress, or something along those lines, certainly caesareans, but there's no need for mums to have a caesarean specifically because they've got a COVID-19 diagnosis. For birth attendants, if mum has COVID-19, they will be wearing PPE, so personal protective equipment, so the funky masks and the attractive gowns and the gloves, and looking very, very glamorous. It's not particularly warm and fuzzy and not ideal, certainly, to be faced with these strange-looking alien creature things in their very funky PPE, but it's important to protect the healthcare workers and the midwives as well. For a while, there was only able to be one support person with a labouring mum in labour while she's in labour. And that was difficult for a number of mums. It's been changed to 2 support people, which is helpful. Labour can sometimes be a long process, and the support people can sometimes need a bit of a backup. It's really important to some people to have multiple people in while they're having babies. So whether it's for personal reasons of preference, whether it's for cultural reasons, more than one person is certainly the preference for a number of people. And it's good that we can at least get 2 people in there now with labouring women. Water birth. So water birth is something that happens in a number of birth centres and hospitals and places in Australia. Now, there is no current evidence that water immersion is contraindicated, but Queensland Health and all the different states will have different recommendations, but I'm in Queensland. So Queensland Health indicate that water birth is not recommended as SARS-CoV-2 has been detected in stools and they may pose a risk to the baby. Other reports suggest that water birth may be beneficial because the water creates a sort of social distancing between mum and the healthcare professionals, and also because COVID-19 isn't a waterborne illness. It's not a waterborne transfer. So a number of studies and recommendations are suggesting that water birth is just fine. Thank you very much. And obviously people will need to discuss this with their health providers wherever they are. Queensland Health has also recommended continuous electronic fetal monitoring as fetal distress has been reported. So continuous electronic fetal monitoring is a couple of big straps around mum's tummy, monitoring Bubby's heartbeat and monitoring mum's contractions. It is a bit on the restrictive side. Sometimes mums are kind of trapped close to the machine, which is not ideal. And it's something that is a recommendation by Queensland Health, and again, it's something that needs to be discussed at the time if necessary. Nitrous oxide, so happy gas, is one of the pain relieving type of medications that a lot of women find really helpful in labour. And one of the recommendations, again, Queensland Health has recommended, is for reasons of healthcare provider protection, avoid use of nitrous oxide by women with suspected or confirmed COVID-19. So that kind of raises the issue of what the PPE equipment is kind of doing there if it's a bit of an issue with nitrous oxide. So realistically, it's probably fine for a woman with a COVID-19 diagnosis to use the gas if her healthcare providers and support people have all got their PPE
on. Chris, I might just jump in there. Just for the benefit of the audience, I will interrupt you just every now and again with some questions. Just a question I had, what can pregnant women do if their planned place of birth is actually closed due to COVID-19, perhaps unexpectedly?
So that is unfortunately happening in some places. And there was a bit of an issue with the birth centre in Mackay. In Australia, certainly, when a birthing venue is closed due to COVID-19, generally speaking, there will be a plan from the midwives or the healthcare providers or whoever it is about, okay, we'll let everybody know that this place is now closed, what our alternate plan is. Yep. So in the case of the birth centre, the pregnant mums were going to be going to the labour ward at the Mackay Base Hospital. They were going to take their midwives with them, so the midwives would be continuing their care in the hospital. And that was the plan. So there will be a plan. Yeah. But a number of mums are also not entirely happy with those plans. And so depending on where they are and what available options are to them, a number of mums are going, well, we'll just have a home birth. Thanks. I'm good. That's what we're going to do. And making a really swift decision that that's what they're going to do. So regardless of where mums have planned to have babies, if their venue is closing, they should really talk to their midwife about their options and make themselves aware of what their choices are so they can make an informed decision from there.
Yeah. So in regards to preference, you were talking before about policies, from Queensland Health. What can a pregnant mother do when she's faced with a hospital policy which dictates perhaps something that she doesn't quite agree with under the justification because of COVID-19?
Okay, so hospital policies are put in place to minimise risk to a hypothetical general population. Having said that, mums are always able to not consent to anything. So they don't have to consent to electronic fetal monitoring.
Yeah.
They don't have to consent to an induction. They don't have to consent to a cesarean. They don't have to consent. So if they choose not to, that's okay. There's actually really not a great deal the hospital can do about it.
Yeah. Okay.
It's one of those things. But mums and their support people need to feel as though they're comfortable, they're informed, they're educated, and this is the choice they're making. So regardless of what the hospital policy says, this is their decision, this is their body, this is their baby, and this is the way it's going to happen.
Excellent. Thanks, Chris. I'll leave you with it now for
cool.
Continue.
So breastfeeding and COVID-19. COVID-19 at this stage has not been detected in breast milk, and people have been testing for it. So that's fabulous. Breastfeeding provides protection from other illnesses. It provides protection from asthma and allergies and ear infections and gastro issues and all sorts of things. So breastfeeding is great, and it's really good that COVID-19 isn't something that seems to be transferable through breast milk. So mothers with COVID-19 are able to breastfeed. One of the things they need to think about is precautions. So if mum has COVID-19 and she's going to breastfeed, she needs to wear the beautiful mask. She needs to wash her hands really thoroughly before breastfeeding. She needs to not cough on the baby wherever possible. So she's certainly able to breastfeed. She just needs to use precautions. And mums and home visiting services and online services are still available to help mums with breastfeeding, because breastfeeding can be kind of tricky, and because everybody's making a run out of the hospital as soon as possible, mums aren't necessarily getting as much feeding assistance as they would normally get if they were in hospital for 2 or 3 or 4 days. And so home visiting services and online breastfeeding services, so the Australian Breastfeeding Association, the Child Health Mob, they're all available for support at home. Okay, so implication for the postnatal period. So when baby's arrived in the world, when mum's gone home, because everybody's still working from home and because of the border closures, potentially mums can be very socially isolated. Sometimes, in a number of cases, mums will organise to have their mums or their sisters or their cousins come and stay with them for a while. And if they're in a different state or a different area, that's not necessarily going to happen. It may mean that the services that were available for mums to go out and interact in things like the baby playgroups and the parenting groups and all of those sorts of things, they're not active at the moment. They're not open at this stage. Everything's online still because we can't have a number of people out. So social isolation is potentially a real issue for our mums.
Sorry, Chris, could I just pause you there? I mean, we all know, I'm sure everyone in the audience knows people who are about to become new parents. What can we do to support them while they're feeling socially isolated and balancing that with social distancing, in light of the health hazards?
Absolutely. So what we can do is do the same things we had been with a little bit of a twist. So normally we would hop over and say, hi, how are you going? So now we have to pick up the phone and we have to FaceTime. Normally we go around and offer to do the housework and things like that, and that's not working so well, but we can drop off food and care packages at the front door and wave and no contact and, hey, we're going now.
Yeah.
If people are several states away, I know that I got food stuff delivered to my parents. So they didn't have to leave the house. I just got on the phone and phoned a food delivery place. So even from a distance, we can do things, and just checking in on them.
Yep.
And if they're having problems, seeing if we can make suggestions about where they can get some help from.
Yep. Excellent.
With the social isolation, there's the increased potential for mental health issues. So becoming a parent's a really big thing. It's a very big change in people's lives. And with the social isolation, with the issues about jobs, and with not being able to go and do things that we'd normally do, there's an increased potential for mental health issues around becoming new parents. There are services that are going to come and check and see how people are going. But it's really important for new parents and for people who have new parents and know new parents in their lives to be aware that they may be struggling, and just check on your people. The availability of community home visiting services. In Mackay, hey, we're kicking goals. We've got child health going out all over the place. Bless them, they're champions. Some places may not have the availability for home visiting services, whether it's because the service isn't going out, or it's telehealthing everything, whether it's because the service has a number of immune compromised staff members, and it's just not able to safely go out and provide services. Another thing that's potentially having an impact is early discharge home. So early discharge home from hospitals is being encouraged at this stage. And for the second and third and fifth time parents, apart from the lack of rest, which is really lousy, they've probably pretty much got it under control by that stage. But first time parents especially, it can be really challenging to be going home with a new small person, and going home early is even more challenging. And the lack of support that they're getting in terms of going home early, we know that lack of support has an impact on breastfeeding rates. And not only lack of professional support, but lack of partner support and lack of family support. So we know that has an impact on breastfeeding rates.
Chris, I might just jump in there again. So, I mean, our community and JCU's backyard is really focused on rural and remote communities. So I imagine that in those communities that might not have as high standards of healthcare against urban areas, telehealth, which you mentioned before, would become quite a valuable tool for pregnant mothers. And I was wondering, how does telehealth work for people that are pregnant and need to be seen for antenatal appointments?
So telehealth in terms of antenatal appointments, it's, again, with COVID-19, it's been a quick shuffle and things have been put in place in a really rapid way.
Yeah.
Telehealth appointments for antenatal appointments. Mums certainly still need to be seen at some stages, but some things they can be checked on with a telehealth appointment. So mum gets on the phone or the computer or whatever it is, and how have you been feeling, and how's your mental health going, and are you feeling baby move, and all that sort of thing. Let's talk about diet. Let's talk about when you're coming in for your next blood tests. And a number of items can be done through telehealth. Alternately, a lot of that sort of thing can be done through telehealth and then have a shorter physical appointment afterwards. So a 15-minute interview through telehealth, and then 5 minutes in either with your midwife or your GP or your obstetrician, check the things that need to be physically checked. You need to have a mum right in front of you to do, and then out the door in a rapid period of time. So by shortening appointments.
Yeah.
So it's aiming to minimise the contact with vulnerable people. And Medicare has at this stage arranged for telehealth benefits to be extended to endorsed midwives as well at this time, which is lovely.
Excellent. Excellent. Thanks, Chris.
Cool. So babies and COVID-19. Until about a week ago, we thought there was no vertical transmission. So we thought it appeared that mums with COVID-19 weren't going to transfer the COVID-19 to babies through the placenta. About a week ago, the British Medical Journal published an article that suggested that it was possible. There had been a number of babies tested within 6 to 12 hours of being born, and they were COVID-19 positive. So probably it was vertical transmission from mum. So the COVID-19 came from mum through the placenta into baby. Having said that, it was a really, really small number. So if you're looking at people getting COVID-19, we've got something like, I think, 7,000 people who have had COVID-19 in Australia. A really small number of those are pregnant people. And of those pregnant people who have got COVID-19, a really small number are going to be sick enough to go to hospital. And of that really, really small number, a very, very small number, sort of around about 5% of babies will potentially get COVID-19 from that. So the odds are against it. They're really against it. And with our small numbers in Australia, that's great. But it's important that we're aware of it and we're continuing research into it. Babies are remaining with mum unless unwell enough to go to the special care nursery. So that's in Australia. And it's really important for babies to remain with mum and not to be carted off into the distance because of bonding and hormones and feeding and all that sort of stuff. They can remain with mum even if mum is COVID-19 positive. So mum's got COVID-19, baby hasn't, fine, still staying with mum. Mum's just needing to take precautions. And breast or bottle feeding as per mum's plan. So whatever mum had planned to do, that's what she's going to do, regardless of whether she has COVID-19 or not. Okay, so kids, children and COVID-19. What we're seeming to see is children do get COVID-19. They seem to have less severe symptoms, generally speaking. They can be asymptomatic, so they can have no symptoms at all and still be positive for COVID-19. Basically, kids breathe in the same way adults do. So it's a bit weird that they wouldn't be spreading COVID-19, but the theory is everybody's going back to school, so the theory is that maybe they don't. In the past couple of weeks, a new hyperinflammatory syndrome has emerged in children that seems to be associated with COVID-19. So what they're finding, what some people in places are finding, are some children who have inflamed internal organs. It's a really rare thing, and it seems to be more prevalent amongst children who have had COVID-19. It's still a really rare thing, but it's something that seems to be happening to children. And again, more research is ongoing because this is so new and it's just something we've started seeing in the last probably month. In relation to children and COVID-19, the recommendations are that immunisations of kids should be continuing on as per schedule, but mass immunisations are being suspended. So where all the kids were going to be lining up in Year 7 to be getting their Gardasil and their tetanus, that's not happening now. And it could be a little bit of a problem because when everybody was lining up at school, we knew that the majority of kids were being immunised. Didn't have to think about it. Off they went to school, got immunised, no problems at all. Came home, I had my immunisation. Oh yeah, that's right, fantastic. Because that's not happening currently, there will potentially be a number of kids who are just missing out. And we're not really sure when the mass immunisations are going to start up again. So there will definitely be a number of students who are late in getting some of the immunisations and may potentially be missing out altogether. So I know my daughter was due to get stabbed, and so we just took her down to child health and no problems at all. She's well on schedule. But being a medical family, we're very much aware of when immunisations are due. And by the time they get to high school, it's kind of an afterthought for lots of families, which is very reasonable. There's lots of things going on in their lives. So down the track, when COVID-19 settles down, we're going to have a lot of catching up to do with a lot of students and a lot of kids about their immunisation schedule. But hey, we'll fix it. Okay, so what's Australia doing in terms of COVID-19 type things? So as I mentioned earlier, Medicare for midwives, which is fantastic. So this is for endorsed privately practicing midwives. Endorsed midwives are trained over and above general midwifery registration, have to have a certain amount of experience, have to be registered by, have to be endorsed by AHPRA, the registration board, and then after that we can apply for a provider number and claim for Medicare. So there's a really small number in Australia. There's about 600 endorsed midwives in Australia, but those midwives can claim Medicare for seeing pregnant mums and seeing postnatal mums. Telehealth appointments. Telehealth are being ramped up really fast, which it's kind of impressive, really. Everybody's doing telehealth. Your GP is doing telehealth, your midwives are doing telehealth, the obstetricians are doing telehealth, everybody's doing telehealth. So hopefully we're managing to cover most of the pregnant people and new mums. Appointment scheduling to decrease contact. So what's happening is previously you'd have one person at 8, another one at 8:30, and the next one after at 9 o'clock with appointments. And now it's more like an hour between patients. So your first patient can come in, your first pregnant person can come in, you can see them, they can head out the door, everything gets cleaned, and then there's a gap in between, and then the next person comes in a little while later, and that way there's minimising contacts between people. Home visiting is another thing that is being done in order to minimise risk of COVID-19 transfer. So if healthcare professionals are going to people's homes to visit them and see them either while they're pregnant or after they've had bubby, it means that mums aren't going to have to go out into the community. They're not going to have to wait in a waiting room with another 30 people and their kids, and they're going to decrease the amount of contacts they have. Privately practicing midwives, there is certainly an increase in business, I guess, in the number of people who are contacting the privately practicing midwives about home births or about coming to see them at home and that sort of thing. And an increased interest in home birth and some free birthing. So home birth is a planned birth at home attended by healthcare professionals, generally speaking, a couple of midwives. Free birthing is a planned birth at home with no healthcare professionals. The midwife in me is uncomfortable with that, mainly because I know what the statistics are for places that don't have midwives, and it's not a great outcome for mums and bubbies. With the information we're seeing about people who are deciding to free birth, a lot of them are deciding to birth at home without attendance because it's too expensive to employ a midwife for a home birth. So home birth isn't claimable on Medicare, and depending on where they are and what service they're trying to employ, it can be somewhere between $2,000 and $5,000 for a home birth. And a lot of people clearly don't have that. So they're choosing to have babies at home by themselves because they feel that's the best thing, the safest thing for them and their baby, to stay away from the hospital. And obviously that's their choice, but it's unfortunate that they can't get a Medicare rebated home birth. So birth in hospital with now 2 support people carrying on, which is good, and fairly minimal visiting, generally speaking, which in some ways isn't a bad thing. Some ways it's kind of nice when mums and babies get to have a sleep without constant visitors. Early discharge is happening from hospitals, generally speaking, where possible. And child, youth and family health are visiting mums at home. So their child health usually come and visit mums at home anyway. And they will come and see mums 1 or 2 times, depending on how mums are travelling. And if they're not travelling so well, the child health people will keep coming until mums have got on top of it and under control. Okay, so what are midwives doing? Privately practicing midwives are seeing more people, more pregnant people, more home birthing people, more postnatal people, because they don't want to go to hospital, thanks. And the options are hospital birth, birth centre birth, home birth, and privately practicing midwives generally operate within birth centres and home births. There's a possible increase in endorsed midwives. So endorsed midwives are midwives who can do home births, who can provide care as an independent practitioner. And AHPRA is trying quite hard to get through as many applications as humanly possible. It's kind of tricky. They're understaffed. There's a lot of applications going in, but they're trying to get through the applications for endorsed midwives as fast as possible. Midwives are offering telehealth services, and some mums, they can't fathom telehealth. They don't want telehealth. They're not interested in telehealth. Thank you very much, and that's fine. Midwives we tend to be fairly flexy people, but it's an offer, and most of the time, a lot of care can be provided through telehealth services. Childbirth education online. So there's actually been a fairly big increase in providers of childbirth education online, understandably, because we can't have childbirth classes at the moment. We can't have a whole bunch of people in a room together, which is traditionally how hospitals provide it. So childbirth education online classes are available for parents if that's something they want to investigate. And mental health support online, which is really, really important at this stage, because there's a lot of very stressed out, very confused, very worried people at this stage. So what are other countries doing? New Zealand pretty much is getting on with the job. They're awesome. They're really lovely. I'd like to move to New Zealand some days. They're carrying on as they would with additional precautions if the woman has COVID-19. So they're wearing their fabulous PPE gear, they're home birthing or they're hospital birthing or they're birth centre birthing, whatever the plan was before, that's what they're doing. Canada is doing fairly similar things. Now, Canada has the added bonus that they had SARS in 2003, it was. And because they had SARS and the pandemic, they've done this before. They've had a pandemic before, and they've had a trial run already. And so they're pretty much organised in terms of how to manage pregnant people in the middle of a pandemic. They've got this covered. So pretty much as per the previous plan, with no separating of mums and bubs. China has recommended no breastfeeding and has been isolating babies and women with either suspected or diagnosed COVID-19, which is really sad. Now, the recommendation in China as well seems to be mainly to have a cesarean for mums with COVID-19, and they've got a pretty high Caesar rate anyway, so usually around 41%, which is pretty high, really. So they sway towards cesareans anyway. And America, the Journal of American Obstetrics and Gynecologists are recommending mums and babies be separated. I can't imagine that's going down too well, but anyway, they may have, reconsidered their stance after the riots and things are becoming even more interesting. In one of the USA studies I've seen, 44% of babies from mums who had COVID-19 had a cesarean. But again, Caesars are pretty common in the States. Their average rate of Caesars is about 32%, but it's increased. since COVID-19 as well. So it's up there. Americans are very risk averse. So that's what America is doing.
Sorry, Chris, can I just jump in there, relating it back to Australia? How many, what's the comparable rate to Australia? And also we have a question here that's come through from one of our attendees. How many pregnant women in Australia actually did test positive for COVID-19 so far?
So at this stage, I don't think we have statistics in terms of number of people tested positive who are pregnant.
Okay.
And I know of one on the Gold Coast that there was a study for, but I don't think that there's been a vast number of pregnant people, and I would expect to see it in the studies. So it's a fairly small number, and considering we've only got 7,000 positive tests, and we've been advising all pregnant people to stay away from pretty much everybody, I'm not entirely surprised it's a very small number. Caesar rates in Australia kind of vary from place to place, and kind of somewhere between 25 and 35%, depending on hospital or that sort of thing. So that's kind of average-ish for Australia in general. But we're not recommending that because mum is COVID-19 positive that she needs a Caesar. We're not doing that, which is fabulous. All right, so places to get more information. I really like the Don't Forget the Bubbles website. It's got a whole bunch of studies, and it's fairly down to earth language. It's just fantastic. It keeps up to date, and it's a lot of kid focused things. The Australian College of Midwives has information for health professionals and for mums, which is really handy. The Department of Health keeps updating based on whatever the current recommendations are. They've got a page for how many COVID-19 cases we have at the moment, what's the new numbers, and the World Health Organization. And they have daily updates on worldwide numbers and recommendations. So they're all, places that people can get more information, as well as talking to their midwife, their doctor, their GP, their obstetrician, their healthcare professionals. There we go. That's about it for me.
Yeah, excellent. Thanks very much, Chris. That was a wonderful presentation. I actually really enjoyed that one. And also thank you to all of you in the audience who tuned in tonight and those who sent through questions. Look, we really would appreciate your feedback so that we can continue delivering interesting and engaging webinars throughout this series. So as such, if you wouldn't mind sparing some time just to complete our feedback survey, that'd be fantastic. So a link should appear once the webinar concludes. As you'll see there, the date for our next webinar is Thursday, the 25th of June, where we'll be exploring the opportunities for social enterprise in North Queensland. However, for now, that's all. So thank you very much and good night.